Hi, my name is Dr. Robert Kaufman, and we're about to go beyond the terminus. One of the most important stages of endodontic treatment is cone fit. Gutta percha cone fit really is the final check to determine whether you have adequate shape and taper to allow you to use the warm gutta percha technique for obturation. There is a tendency to regard nickel titanium rotary instrumentation as shape-creating instruments, rather than as tools for trying to remove complicated pulp anatomy. Research has shown these canal systems are much more complex than the tapered funnels that we create with our instruments. Also, many of the shapes that we create leave a lot of untouched canal space. Nevertheless, they work in most cases, which is probably more of a testament to the body's ability to heal rather than our ability to get these canals as clean as we think. There are going to be many situations in which the apical anatomy is extremely complex, where bifidities and trifidities occur, and where the classic cone fitting techniques in prepared canals simply don't work as well. This is especially true in cases of retreatment, where the original canal anatomy has been altered or the canals have been ledged. Also, as canals get less and less tapered due to the movement toward less tapered instruments and smaller canals that conserve dentin, it becomes harder and harder to use the concept of tugback when we fit gutta percha cones. One of the ways that we can improve adaptation of the gutta percha cones to what may be a very complicated canal space is by using a chloroform dip technique. In apexification and apexogenesis cases, we may not have the classic apical constriction. Don't get me started on the myth of apical constriction. We'll deal with that in another video. And the need to fit gutta percha cones against artificially created stops that don't lend themselves easily to the use of out-of-the-box, non-standardized gutta percha cones. In those cases, I prefer to use a chloroform dip technique. Many years ago, a company called JS Dental used to sell a Scandinavian-made hollow tube with a metal base that was used to store a tiny amount of chloroform. Because the opening in the tube was so small, there was minimal hazard to staff, and studies have shown that the vapor diffusing into the environment was proportional to the cross-sectional area through which the chloroform diffuses. By having such a tiny little tube, these vapors are minimized. When we're ready to cone fit, the tube is filled with chloroform and the appropriate sized gutta percha cone is dipped into the tube for 2 or 3 seconds. The gutta percha cone is placed in the canal, and basically what you're doing is taking an impression of the apex. Care must be taken not to leave the gutta percha in the solvent for too long, as this can degrade the gutta percha and break it down and make it too soft. A minimal in and out motion with no rotation is used to ensure that the cone can be removed with the impression of the canal. Once the cone is removed, I mark the buccal surface of the cone with a dot created by using my Endo Explorer. This ensures that when I place the cone back into the canal in the subsequent appointment, the cone fits exactly the way it was inserted initially. It's important to remove the excess chloroform from the gutta percha before placing it into the canal or storing it. This is done by dipping it into a dappen dish full of alcohol and then using air to thoroughly dry the cone. Okay, so this is a couple of different ways that we can go about softening a gutta percha cone. The way that I do it is by using this tube. And this tube is unfortunately no longer available. It was made by JS Dental. Basically, what it is, it's a metal disc on the bottom, which has a rubber ring on the bottom of it, and the tube fits over top, and you fill this with chloroform. The advantage being that the opening is very small, and you don't have an entire huge dappen dish full of chloroform, which can solubilize into the air. So, very small opening. What you do is take your gutta percha cone and dip it in for a couple of seconds, 2-3 seconds. Try it in the canal. Make sure you mark the direction of the buccal aspect of the tube. So that way, when you put the gutta percha cone in the canal back in there, the irregularities and the way that the gutta percha cone conforms to the canal is put back in exactly the same orientation. Otherwise, if you put it in a different orientation, it may not go in properly. That's one way, by using this chloroform dip technique with this little device. If you don't have one of these, and unfortunately they're not made anymore, so I'm not even sure where you can get them or if you can get them, one easier way is just to fill your syringe, good old-fashioned irrigation syringe, with a little bit of chloroform. You can either use an insulin syringe or one of these Monoject 6cc syringes and use that to dip it in 1, 2, 3. Try it in the canal. You can possibly try it a second time. I wouldn't do it more than that because what happens is this will start to degenerate. The gutta percha will start to break down and get really soft. At that point, once you got the correct fit that you want, mark the buccal aspect, take it out, put it in some alcohol in a dapping dish, and make sure you air dry it. So you remove all the excess chloroform, and then you can either put it into the canal to finish the case, or if the case is being medicated, we can then store it and then come back later and you know exactly the direction to place it for best fit. Hope that helps you with gutta percha cone fits. Because the cone now fits intimately into the canal, caution must be used when applying sealer to the cone. Because the cone now fits so closely into the canal, it's easy to drive excess sealer apically, so a minimal amount of sealer must be used. It's not uncommon to see multiple portals of exit with this technique, which are filled with either gutta percha, sealer, or a combination of the two. In cases where cone fits are impossible because of the variation in anatomy or our inability to create a classic preparation shape, we will use what is known as a System S, or the squirt technique, made famous by Dr. John Stropko. I will be discussing this in a separate video. Here's an example case of a bifidity that we have confirmed with a CBCT image. Here's the example case that we're looking at. We can see in the reconstruction here a very large lateral canal coming out of the mesial side of this premolar, causing a fairly large defect. So this lateral canal may in fact be as large or perhaps even larger than the main canal. And we can see as we move up and down the scan that there is in fact an opening right here laterally, right exactly where it shows. So for this situation, we need to have a filling material that can probably not only negotiate this canal, but possibly the main canal or the canal underneath it, which we can see right here. The cone fit procedure is really the final check prior to obturation. If you're pulling out your gutta percha during the procedure, it's likely that you don't have sufficient tugback and you don't have the proper size gutta percha cone for the canal. Similarly, if you're constantly filling short of the desired length, it's important that you check the cone fits after they have been placed in the canal, either with or without sealer. While the radiographic appearance of the case may not be the ultimate determination of how well the case has been treated, until we get evidence of radiographic healing and resolution of all the symptoms, it's pretty much the only method that we have to ensure that the best possible treatment has been achieved. Remember, when we do the right thing, we both get better, patients and clinicians. Thank you for joining me on this edition of Beyond the Terminus. Please remember to like and subscribe. This channel is free and unsupported. If you feel this channel is valuable, I'd appreciate you recommending this to your fellow clinicians and colleagues. I'm always looking for topics and suggestions that may address any questions that you have regarding endodontic treatment. Just drop a note in the comment box below the video. I look forward to our next trip when we go beyond the terminus. See you then.